Nathan's injuries that we know about are mostly his lungs. His initial neurological exam and so forth has actually been remarkably good, and we expect a full recovery or close to a full recovery of his neurological function. And his lungs are moderately sick at this point for an ICU patient, and I actually expect him to recover and be able to get off the ventilator and go home eventually. What we're expecting and what we've told the family is that we need to do some additional testing of his brain and so forth. We need to continue to look at his lungs. We've been doing daily bronchoscopies to try to get the sand out, as well as the inflammation that occurs from the lungs because they've got a foreign body in them, the sand. But if he continues to recover at the rate he is, we expect him to be off the ventilator by the end of the week, perhaps out of this hospital in 10 to 14 days, 1 week to probably a month in rehab, depending on what everything looks like once we get his breathing tube out and see what he looks like, and then hopefully home. We have told the family we're not sure what his long-term lung injury is going to be, because fundamentally, at least what I've been able to look up over the weekend, this is case report material, and all the reports that I have seen thus far really just talk about the patient in the intensive care unit and whether they survive or don't survive. And we know that when you have foreign bodies in your lungs, that your lungs can have some chronic changes and can have some chronic response to that. We absolutely don't think we can get every grain of sand out of his lungs, because sand is sand, and we all understand when we go to the beach and we get sand and things that we find sand 6 months later, and unfortunately we believe he's probably going to have sand in his lungs 6 months later as well. But we are washing out as much of the sand as we can with the daily bronchoscopies. So he is at risk of infection. But the other issue with foreign bodies is that your body tries to just fight it off, and that can lead to an allergic reaction. It can lead to an autoimmune reaction, which means that as your body starts to fight off that foreign body, it may actually also end up fighting itself some, and cause wheezing, cause just the inability to take a deep breath and have normal breathing in the future. And it's just really hard to tell what, if anything, will happen. And I have not seen reports as to what the survivors of this look like at 6 to 12 months or several years out. He actually, I don't believe, got intubated until he got to the outside hospital. So he was breathing at some level on his own before when he was found. I believe he had to have an air pocket down there, and because that's the only way that could have been the case. So I expected him to arrive much sicker than he did, and since he didn't arrive sick, I actually expected the first 24 hours to get worse, and he really did not there either. Because of his lung injury, we are trying to keep him sedated with medication, and intermittently we have also had to give him medicine to paralyze him. So we actually don't want him awake and following commands and so forth. When he first came up to the ICU, we briefly turned off his sedation so that we could see how active he was, and at that time he was completely appropriate, trying to pull tubes out, which we clearly don't want them to do, but he was really acting like a very purposeful 6-year-old. And then we have put him under sedation at this point, but he is still moving everything. He is still, when he is lightly sedated, still responding to anything that may be painful or responding to touch. And so those are all things to me that indicate he is a 6-year-old who is sedated right now and his brain is functioning normally. We have done CAT scans that look normal at this point. There will be additional testing that will occur over the next couple of days, an MRI, which will give us a little bit more detail. And then the biggest thing is just waking him up and see how he does. But all of our indications is his brain function is normal. Anytime there's been a trauma, I always tell families that sometimes there can be some minor brain injury that we may not even pick up in the ICU. It may be something that they pick up down the road. The greatest challenge is getting the breathing tube, is having his lungs get to a point that we can take the breathing tube out, and I expect that we will be able to do that over the next couple of days. And then if he wakes up and acts normally, as I believe he's going to, I think the biggest thing moving forward is just watching his lung function. And theoretically, if it's an autoimmune response or a response to an allergic response, it may take 6 months to a year for us to even see it. So I think it's going to be the unknown for the family moving forward about his lung function, because he was clearly an active boy, and and the family wants him to return to that, and so do we. So at this point, we don't see sand when we're going down. We've been able to get down to the major airways. After the MRI today, we hope that we can clear his spinal column and take his collar off, and then the pulmonologists hope to go deeper down, but we don't see any sand. But again, sand grains were small. We are still getting sand from other parts of his body off every single day, so I'm sure that he still has sand deep. And I'm just gonna. Another question that has been asked is about his eyes. The ophthalmologists washed out his eyes when he came in, and they look normal and don't look like they have any significant injury. Again, that's going to be something we will have to completely determine once he's awake and tell us how he sees. But the ophthalmologists are not concerned about his eyes right now, which again is, my guess is he probably closed his eyes while he was underground.